Good morning, everyone, and thank you very much for the introduction, Amy. My name is Mary Lou Bushnell, and I'm a neuropsychologist at the Phoenix VA, and I'm very excited to speak to you all today about traumatic brain injury and brain health. Next slide, please. So the views expressed in this presentation are my own and do not reflect those of the VA or the US government, and I have no financial relationships to disclose. We'll do the next slide, please. So I'd like to start off with some statistics. 1.7 million people seek medical treatment for traumatic brain injury, but the actual incidence is estimated to be about 3.8 million per year. Traumatic brain injury accounts for approximately 1/3 of all injury-related deaths, and more than 80% of traumatic brain injuries are sustained in a non-deployed setting, such as car crashes, training, falls, and sports. Most people who sustain a traumatic brain injury sustain a mild TBI, and most people do recover in a matter of weeks. Mild traumatic brain injury, or MTBI, is also referred to as concussion. Next slide. So what exactly is a TBI? This occurs when an external force, often a blow or a jolt, causes structural damage to the brain or disruption of brain function. Traumatic brain injury can be classified as mild, moderate, or severe. Next slide. And this scale is used by the VA and the Department of Defense to classify the types of traumatic brain injuries. So again, it can be mild, moderate, or severe. And the way this is classified is based on duration of loss of consciousness, alteration of consciousness, or feeling dizzy, dazed, or confused, the length of post-traumatic amnesia, which refers to loss of memories before or after the injury. And this is actually one of the most robust indicators of long-term outcome. Sometimes we can use something called a Glasgow Coma Scale score, and this is a rating of responsiveness at the scene of the accident or injury. And then finally, we look at neuroimaging. So as you can see from this chart, someone with a mild TBI often has normal imaging findings. They may have loss of consciousness for 0 to 30 minutes. Alteration of consciousness can be 24 hours or less. Post-traumatic amnesia might be 1 day or less, and they're going to have a higher rating on that Glasgow Coma Scale score. In contrast, somebody with a severe TBI would have loss of consciousness for a longer period, more than 24 hours, post-traumatic amnesia for more than 7 days, and lower on that Glasgow Coma Scale score. And then, of course, moderate TBI falls somewhere in the middle. Traumatic brain injury, especially in the VA setting, is usually a historical diagnosis. So sometimes it can be difficult to estimate how long somebody was unconscious or had that alteration of consciousness or post-traumatic amnesia. And we typically base this on the patient's self-report or medical records to help diagnose and classify the type of traumatic brain injury. It's also important to know that an individual can be dazed or confused or disoriented for reasons other than the TBI. Sometimes it's psychiatric reactions to a traumatic event can also lead to some of those similar symptoms. Next slide, please. So on this slide, you see some numbers that are updated every year by the Department of Defense. And this looks at service members who have sustained traumatic brain injury. So this slide shows that 434,618 service members sustained traumatic brain injuries from 2000 to 2020. And as you can see here, 82% are in that mild range. Next slide. So when we talk about traumatic brain injury, there's two major types. We have a penetrating head injury, and we have the closed head injury. And this picture on the left here, this might be a familiar face to some of you. This is a very famous case of a penetrating head injury. This is Phineas Gage, and he was a railroad worker, actually the foreman in the 1800s, and he sustained a traumatic brain injury when a tamping iron went through his brain in an accident. And he survived this injury, and it led the field to a much better understanding of the importance of the brain's frontal lobes. And as you can see on the right side, here's an example of a closed head injury. We can also call this a non-penetrating head injury. And this is much more common than the penetrating head injuries. And it occurs when the brain moves around inside of our skull. And this can result in bruising or shearing or tearing of the brain. Injuries can also be classified as focal or diffuse. And so a focal brain injury would be when damage occurs in a specific area of the brain. And diffuse brain injuries is when more than one area is damaged or when the damage is more widespread. All right, next slide, please. So what puts our service members in particular at risk for TBI? Well, when we look at those who are most likely to sustain a TBI, the highest risk includes the very young, such as babies and the elderly, but it also includes males in between the ages of 18 to 24. And this is often the age of our service members. Also, individuals who engage in activities that are physically demanding and potentially dangerous, such as many military training activities, and certainly deployment can put folks at risk as well. But in addition to military activities, service members can also be at risk because of certain leisure activities. Next slide. So I'd like to spend a little bit of time talking about blast injuries, as blasts are the most common source of TBI, particularly mild TBI in deployed settings. It's also a high cause of death in deployed settings. 72% of battle casualties were caused by blasts. So we'll go to the next slide. We'll talk a little bit about primary blast injuries. So a primary blast injury results from a blast wave induced changes in atmospheric pressure. So the research is still going and still ongoing controversy as to whether or not the blast force alone directly injures the brain. We know that gas-filled structures such as lungs, the GI tract, and middle ear, those are all can be impacted by blast. We think it might be impacting the brain as well, but we're still trying to figure out exactly how the blast wave itself impacts the brain. And one of the reasons why it's so hard to study this is because these primary blast injuries are often accompanied by secondary and tertiary blast injuries, which I'll talk about next. Next slide, please. And so secondary blast injury results from objects being put in motion by the blast wind and how that impacts a person. So for example, being struck by debris from a blast or even being struck by a weapon that someone is holding during a blast. This can include both injuries due to flying debris and collapse of structures. And then the next slide, we'll talk about tertiary blast injuries. And this results from a person being blown into solid objects by the blast wind. So maybe a blast would cause someone to be blown off of a building or blown around inside of a vehicle. And we'll go to the next slide. And quaternary blast injury are all other explosion-related injuries, illnesses, or diseases that are not due to primary, secondary, or tertiary mechanisms. So this can include burns, inhalation injuries, and other types of injuries. So many service members experience a combination of many of these types of blast injuries, all in one incident. We'll go to the next slide. So there's been a lot of research comparing how do blast injuries differ from other types of traumatic brain injury. So undoubtedly, blasts are a very different mechanism than blunt force trauma, but the research has shown that the severity of the injury and the duration of loss of consciousness appear to be more important in determining the long-term outcomes rather than the mechanism of injury, whether it's a blast or a blunt force trauma. But research also shows us that individuals who were involved in blast-related TBI are marginally more likely to also have PTSD, as opposed to those that have sustained TBI secondary to a blunt force trauma. All right, next slide, please. Okay, I'm going to talk about some of the common symptoms of TBI. This is certainly not an exhaustive list, but we'll go to the next slide. And we have these broken up into physical, cognitive, and emotional. We'll go to the next slide, please. So this first list is comprised of physical symptoms. And here we have included things like headaches, sleep disturbances, dizziness, balance issues, nausea and vomiting, fatigue, visual disturbances or changes, light sensitivity, ringing in the ears, and changes in sleep. And so these are often the symptoms that someone might go see a neurologist or a physiatrist for in order to be evaluated and treated. We'll go to the next slide, please. And the second list has cognitive and emotional symptoms. And these are symptoms that somebody might go see a neuropsychologist for or to get evaluated and treated. And these include things that, such as changes in thinking, so slowed thinking, concentration difficulties, memory problems, word finding. It also includes emotional changes like anxiety, depression, irritability, and mood swings. Excuse me. Fortunately, most individuals with mild TBI fully recover with all of these symptoms, but certainly some do not. Go to the next slide, please. So I want to talk a little bit now about the co-occurring symptoms. Many individuals, especially service members and veterans, have both PTSD and a history of TBI. So certainly these two conditions have very different causes, but the same incident, such as a blast explosion, can lead to an individual developing both traumatic brain injury and post-traumatic stress. Each has unique symptoms, and this is listed on this slide. So for example, with PTSD, flashbacks, avoidance, hypervigilance, nightmares, and re-experiencing. And with traumatic brain injury, there might be symptoms, physical symptoms such as headache, dizziness, nausea, vomiting, vision problems, and light and noise sensitivity. But there's also many overlapping symptoms in TBI and PTSD. And these include things like fatigue, insomnia, depression, irritability, and anxiety. And while not listed here, other things such as chronic pain and insomnia can also lead to these same overlapping symptoms. And research shows that when an individual engages in PTSD treatment and PTSD symptoms improve, he or she tends to notice an improvement in the thinking skills or cognitive functioning as well. We'll go to the next slide, please. So I want to talk a little bit about what can folks do if they sustained a traumatic brain injury. So immediately after a TBI, it's often a good idea to seek medical treatment. And in some cases, especially in moderate severe TBI, rehabilitation and different treatment needs need to be addressed. Certainly avoiding additional brain injuries is a good thing for our brain. But the good news is that the brain is always working to repair neural connections, and this is called neuroplasticity. The brain is always working to heal itself, even following very severe injuries. The amount of recovery after a brain injury is variable. It depends on a lot of factors, but most spontaneous recovery occurs within 2 years, and most individuals with mild traumatic brain injury recover more quickly than this. And it's really important to note that we can all be doing things lifelong to improve our thinking skills, our brain health, and to reduce our overall risk of dementia. Do the next slide, please. So brain health is a big industry. It's actually an $8 to $10 billion industry. There's a lot of programs and supplements out there targeting brain health. I'm sure you all have seen these advertised on television, magazine, newspapers. But unfortunately, there isn't a lot of evidence to show that any of these products to improve brain health actually are the magic bullet or actually work as well as many of them claim. There's a lack of regulation of over-the-counter supplements, which means some of the big claims are often made without the science to back it up. There's also many brain exercise programs for purchase. One example, Lumosity, that folks may have heard of, it was actually sued because they failed to produce scientific evidence regarding the extent of the benefits they were claiming. So bottom line, if something seems to be too good to be true, it probably is. But we're going to go to the next slide and talk a little bit about what we do know about improving thinking skills. So what do we know? What does the research say that we can do to improve our thinking? What do we know about how to keep the brain healthy? And while there is no magic pill, there are some things we can do, all of us can do every day to reduce the risk of dementia or delay the onset. We'll go to the next slide, please. Okay, so there's a lot of research that shows that keeping active is good for the brain and has protective effects. And this includes physical activity, mental activity, and social activity. It's never too late and it's never too early to start implementing these things. We'll go to the next slide and start with physical activity. So physical exercise is actually the closest thing we have to a magic pill for the brain. Exercise has immediate positive impact on the brain and it helps with focus and memory. Exercise also has long-lasting protective effects on the brain. It's been shown to reduce risk of stroke, Alzheimer's disease, and other types of dementia. Exercise also can improve mood. The common recommendation is 20 to 30 minutes of exercise per day, but even small amounts of exercise have been shown to be helpful for brain health. We know that exercise can lead to neurogenesis, and that's that growth and development of new neurons I was mentioning before. Exercise boosts blood flow and oxygen to the brain. Exercise can increase the size of the hippocampus, and this is the part of our brain responsible for memory. It's also been shown to benefit other areas of thinking, such as our executive functioning or our higher level problem solving skills, attention, processing speed. So we all might want to consider taking a brisk walk or doing some kind of exercise before our next big work project or exam. And it is best to do a combination of cardiovascular exercise and weight-bearing exercise. But any type of exercise has been shown to be good for brain health. Next slide, please. All right, so exercise has been studied with a lot of health conditions, and it's been shown to be good for most health conditions. And I've just listed a few here, including traumatic brain injury. However, many individuals find it difficult to exercise because of chronic pain or other chronic medical conditions. And so if that's the case for you, I want to make sure everyone's aware that the VA has some wonderful programs through rec therapy that can take into account these limitations and help veterans find the right exercise program that can be safely done. It is important to check with your healthcare provider before starting a new exercise program. And this is something, again, there's a lot of VA programs that can help you with this if this is something that you want to start up. We'll go to the next slide now, please, and talk about mental activity. So mental activity, or keeping the brain active, is also very important. And kind of like exercise, any mental activity can be good. For example, activities such as reading, photography, painting, playing board games, visiting museums, even virtual museum tours have all been shown to improve cognitive health and reduce risk of dementia. Reading in particular has been studied quite a bit and has been shown to be a very brain healthy activity. And the recommendation is to consider engaging in a variety of activities, not just one single activity, and also consider starting a hobby that might be new, unfamiliar, might be a little bit challenging. The brain especially benefits from new and challenging experiences. We'll go to the next slide, please. All right, social activity. Social activity is associated with less cognitive decline and also lowers risk of Alzheimer's disease. When you're socializing, the blood circulates to different parts of your brain as you're listening, as you're formulating responses and engaging with others. Studies have shown that strong social engagement might compensate for a reduction in other lifestyle activities, and strong, resilient relationships have been shown to help people recover better from TBI. And it's also been shown to help folks overcome some of the symptoms of TBI, such as depression. There's been a lot of research out there that shows that connecting with friends reduces depression risk as well. We'll go to the next slide. So nutrition. Nutrition is one of those things that benefits your brain both in the short and the long term. I'm sure we've all had the experience of feeling kind of sluggish after a big Thanksgiving meal. But there's also studies that show that diet can reduce the risk of cognitive decline and dementia. Specifically, there's been research for a long period of time about the Mediterranean style diet. And this has been shown to be particularly good for your brain health. We also know that what's good for your brain is good for your heart. And the Mediterranean diet consists of high fruits, vegetables, whole grains, beans, nuts, legumes, moderate levels of fish, seafood, olive oil, less red meat and sweets, combines omega-3s and vitamin D and antioxidants. And again, it's been shown time and time again to reduce the risk of cognitive decline and dementia. There's also some similar diets out there called the DASH and the MIND diets, and they have comparable cognitive benefits as well. Like with exercise, it's good to talk with your doctor or dietitian before making any major dietary changes. And I also want to put a plug in for the wonderful VA dietitians. They can answer questions about diet. They can make recommendations specifically to you. There's individual meetings or group sessions. And every primary care team, every PAC team has its own dietitian. Okay, so we'll go to the next slide, please, and talk a little bit about sleep. So I can't see you all, but if I were to ask for a show of hands of all the individuals in the audience who have sleep problems, I bet I would see a lot of hands raised. Unfortunately, sleep is a common problem, and it's even a higher problem in the veteran population. According to studies, 60% of service members get 6 or less hours of sleep per night. Those who have been previously or are currently deployed sleep even less, many fewer than 5 hours per night. And sleep habits can persist even when folks are discharged from the military. Traumatic brain injury can also negatively impact sleep. So ongoing sleep problems, unfortunately, have been shown to negatively impact the brain, and sometimes in some pretty significant ways. So insufficient sleep has been shown to lead to slow thinking, reduced attention span, memory problems, poor or risky decision making, lack of energy, depression can be impacted by sleep, as well as other mood changes such as stress, anxiety, or irritability. There's a term called short sleeping, which is defined as less than 6 hours per night. And this also leads to some increased risk of other health conditions such as diabetes, hypertension, heart disease, and obesity. The ideal sleep window is 7 to 8 hours per night, but this certainly varies from person to person. Some people need more than that, and some people need less than that. But if sleep is something that you're struggling with, one of the best treatments out there, and actually the first line treatment for insomnia, is something called CBTI, or cognitive behavioral therapy for insomnia. And I'll talk about that a little bit more in a future session, but this is what's recommended to help with sleep, even above sleep medications. We'll go to the next slide, please. I also want to highlight this resource, and it's called My Healthy Sleep Center, and it's part of the My Healthy Vet website. And there's some really great tips for healthy sleep. There's sleep diaries and different strategies to improve sleep. I'm going to share a few of them with you, but I encourage you to check out this website for more. Some of the recommendations for healthy sleep are keeping a regular bedtime and wake up time, even on weekends. Doing the best you can to make sure your bedroom is quiet, dark, and in a relaxing environment, having it not too hot nor too cold. Having a relaxing bedtime routine. So maybe a hot shower, thinking about some relaxing thoughts, maybe meditation, progressive muscle relaxation exercises, something to kind of help you wind down before bed. It's important to use the bed for sleeping. It's not recommended that you read in bed, do work in bed, watch TV in bed. All of these things can make it more difficult to associate the bed with sleep. It's recommended that you go to another room if you don't fall asleep within 20 to 30 minutes, and then come back when you're feeling sleepy again. Avoid bright light exposure near bedtime. So this includes cell phones. And I think that this is hard for us these days. We have our cell phones with us all the time, but that blue light in the cell phone can make it difficult for us to fall asleep. It's also recommended to avoid the following a couple hours before bedtime. So avoiding caffeinated food or drinks, avoiding heavy meals because the digestion can impact sleep, nicotine or alcohol, heavy exercise. So while exercise in general is shown to be really good for sleep, it helps us sleep better. Some people find that if they do really heavy exercise right before sleep, it kind of energizes and wakes them up, and it's more difficult to fall asleep. It's recommended that you stop work or viewing TV at least 1 hour before bed. I think this has been especially difficult lately with many of us working from home, and it's tempting to go straight from work and on the laptop to go into bed. But this doesn't give your brain the time to kind of wind down and help prepare it for sleep. And if you have questions about supplements or over-the-counter medications, please consult with your provider before taking those. All right, next slide, please. Okay, let's talk about stress. Just like sleep, unfortunately, this is a very common issue for many of us. And stress alone can explain why some folks feel like they can't seem to focus or remember things very well. So while some stress is good and it can help motivate us to perform better, so if we have a little bit of stress, we might help us to prepare more for an upcoming exam. If we have too much stress, and you can see in this picture here, it can negatively impact our cognitive performance or thinking. It can lead to anxiety and disorganization and make us less effective. What happens in our brain is that excessive stress alerts our brain that something is wrong, and it kicks our brain into a fight or flight type response, and we're less able to use this front rational decision-making part of our brain. Cortisol is released during the stress response. And again, this is a good thing if we need to get ready for action in a life or death situation. But too much cortisol over too much time can negatively impact our cognitive skills, such as processing speed, memory, and those higher level executive functioning skills. And over the long term, cortisol is neurotoxic and can kill our neurons in our brain and shrink our brain regions. So the hippocampus, that's also pictured here, again, what is responsible for memory, is actually one of the areas most affected by stress. Stress also impacts the frontal lobes, again, which help us to think creatively and help with working memory. All right, next slide, please. So what are some strategies to cope with stress? So stress management is really unique to every individual. I've listed a few here, but really the idea is to find something that works for you that helps lower your stress and implement that as often as you can. So some examples here, mindfulness is one activity, and this could even just be mindfully doing the tasks you do every day. So mindfully washing the dishes, or mindfully, folding the laundry. Just being present and in the moment can really help with our stress. Meditation and yoga have also been shown to be helpful with stress reduction. Gratitude. So just thinking at the end of the day or at the beginning of the day, what are 3 things that you're grateful for? This has also been shown to be very good for stress. You can write this on a piece of paper or a gratitude journal. They even have apps that you can use that can help you track these positive things that have happened in your day. Social interaction absolutely can help with stress, can help with mood, and it's very positive for our overall brain health. And then of course, eating and sleeping well are positive things for stress as well. So again, important to find the techniques that work for each of us and to do those on a regular basis. All right, next slide. All right, addressing secondary factors. So many people with traumatic brain injury find that when they address secondary factors or other factors such as insomnia, depression, stress, pain, fatigue, they find that their thinking skills improve significantly. Often it's their attention that's improved, and then that in turn positively impacts other areas of thinking. And individuals find that they're much better able to function at work or at school, and it has very positive effects. We'll go to the next slide, please. So modifiable risk factors refers to things that negatively impact the brain, but that we have an ability to change to some degree or modify. So managing factors or treating conditions such as diabetes, high blood pressure, and obesity all have a positive impact on brain health, reduces dementia risk. It's also helps reduce our stroke risk, and it also is good for our heart. We know that smoking in particular affects the brain on levels large and small. Smoking can lead to atrophy or shrinkage of the brain, and smoking can impair our efforts to learn and remember new information. There's been some studies that have shown that smoking increases dementia risk by 26%. However, on the good news here is quitting smoking can result in gains in memory and executive functioning over time, probably within a few years. And after 10 years of smoking cessation, ex-smokers showed pretty much the same level of age-related cognitive changes as individuals who have never smoked. Of course, giving up smoking has many other health benefits as well. And then diet, as I mentioned before, can have a big impact on our brain health. So next slide, please. So let's talk about compensatory strategies. What can we do today and every day to improve our memory, improve our attention, and all the things we need to do to function? So I'm going to review both external and internal cognitive strategies. And regardless of your current level of cognitive functioning, these things can be implemented by everyone and can improve our functioning. So we'll go to the next slide and talk a little bit about external strategies. Go to the next slide, please. Thank you. So external strategies can be helpful for everyone. And even if you don't have any cognitive difficulties, we all live in a very fast-paced, information overload world. And so I'm sure many of these you're already using. Using things like calendars, alarms, and lists can really help us free up our brain to focus on other things. Setting alarms on cell phones or kitchen timers to help us remember to take medications, or maybe setting an alarm to help you remember an appointment is coming up. All of these can be really helpful external reminders. Grocery lists, other to-do lists, all of those are helpful. I sometimes have patients ask me, isn't it better that I just remember or try to memorize my grocery list to challenge my brain? And my answer to that is normally, you can certainly try to remember the items, but definitely take that list out of your pocket and look before you check out and drive all the way home and don't have the most important ingredient for dinner. So lists can really help us to not have to stress about holding that information in our brain. And actually just the act of writing down information actually increases the chances that it'll be remembered. Having a home in your home for things that you use all the time. So having a place in your home for your keys, your wallet, glasses, all of this can help reduce stress associated with constantly searching for things. Things like pillboxes, they're not only convenient, but they also can help prevent the sometimes dangerous consequence of forgetting a medication or accidentally taking a medication twice. We'll go to the next slide now and talk a little bit about internal strategies. So those are things that we can implement, external devices and tools, but there's also some things we can do the way we approach information. So for example, simply stopping and pausing while doing an action can help us increase the chances that we'll remember it. I'm sure many of you are like me and you've left your home at one time or another, and all of a sudden you think, oh my goodness, did I turn off the coffee pot or did I shut the garage? And this is common. This happens to most of us. And this is generally related to attention. We have so much going on as we're leaving the house that we didn't really attend to whether or not we did these things. So one technique is to stop, So if say it's the garage, you stop, you pause as you pull out, and say shutting the garage door. So even stopping and watching it go down and saying it aloud can help increase the chances that you'll remember it later. Repetition. Repeating things is always good for our memory. And one example of this is learning names. Again, this is something that a lot of us have trouble with, but when meeting someone new, again, stopping and pausing and really listening to the name, repeating the name several times in conversation. So, hi, John, nice to meet you, John. And as you're leaving the conversation, I'll see you later, John. The more we say that information, the more likely it is to be encoded into our brain. Similarly, paraphrasing or repeating what you heard in your own words can also be helpful. An example of this might be in a medical appointment. Maybe you've been given some news by a doctor, diagnosis, some medications. It's always a good idea to say, okay, this is what I heard you say. And by paraphrasing it, you're not only encoding it better in your mind, but you're giving that person the opportunity to say, oh, well, and also this, or no, that wasn't quite right. This is what I said. And so it's a form of repeating that can help us make sure we're getting information in correctly. It's also recommended that we focus on one task at a time and complete it in its entirety before moving on to the next task. This is hard to do, again, in our fast-paced world. So how many of you have, cell phone alerts that might be going up and you're in the middle of working on something and you get distracted by that? It's actually hard to come back and have that same amount of focus once you're distracted. So to the extent that you're able to, if you can say, okay, for 30 minutes, I'm going to work on this task and then take a pause and do something else versus switching back regularly. And similarly related, it's important to take regular breaks from tasks that require prolonged attention. In general, regular breaks from complex tasks help us prevent lapses in attention. It can help us be more accurate. And this is especially important in our new virtual world. There's been a lot out there about, looking at computer screens for 12 hours without a break, how hard that is on our attention and our focus. So taking regular breaks, taking your eyes away from the computer, stretching, doing something different, this is good for many areas of functioning. Routine and structure are also very good for our brain. We seem to be very good about routine and structure for our babies and our pets, and we know that's very good for them with bedtime routines and those kind of things. But as adults, if we can implement routine and structure, this is good for our brain health and our mental health as well. All right, we'll go to the next slide, please. So I want to highlight some of the resources offered through the Phoenix VA. And the first one I want to talk about a little bit more, I mentioned it before, was cognitive behavioral therapy for insomnia, or CBTI. And this is the first line treatment for insomnia, as I mentioned. It's an extremely effective treatment. 70% of people who complete this program have significant improvement in their sleep symptoms. This is done individually. This is done in a group format. I believe right now it's being done over telehealth as well. And it's something that can be very, very effective for helping with insomnia. There's also many resources for mental health treatment at the VA. So this includes psychiatry or medication management. There's also many different types of psychotherapy. And this is available at many of the different clinics. And you can go to an orientation and learn about the types of therapy and help get connected to the one that's right for you. Recreational therapy, it has many programs. I believe the Phoenix VA is one of the biggest in the country. There's so many different ways to do that physical and mental activity. They have things such as chair yoga, adaptive sports. They also have programs that involve art, leather craft, exercise, so much more. So if you're interested in rec therapy, that's something that you could get a referral from your provider, and they would meet with you and just talk, what are your interests? What are you looking for? And then help connect you to the right program. The other resource that I want to talk about is speech language pathology. So certainly they work with language, that's in their name, but another thing that our speech language pathologists do quite commonly is they help people with compensatory strategies, or help people that are having memory or attention problems in their day-to-day life, and work with you on how you can improve that, how you can be more effective at work or in school. And these can be, a couple sessions or many sessions, depending on your interests and your needs. But that's a wonderful resource as well. And that's a one-on-one appointment. And then nutrition, I've already talked about. I actually listed their number right here because this is a service you don't need a consult. You can just call them directly to schedule an appointment. And again, they're part of every PAC team. So let's go to the next slide, please. So I want to talk a little bit about Brain Boosters. This is an 8-week class that we offer at the Phoenix VA that I facilitate. And much of the content is similar to what I discussed in this presentation. We talk about how to keep the brain healthy over the lifespan. We spend a lot of time talking about day-to-day strategies you can implement to improve your memory and other thinking skills. It's open to veterans of all eras and their family members. And it's a fun interactive group. We're doing it all over VVC right now, and that's something you could self-refer, and we'd be happy to sign you up. We'll go to the next slide, please. So I just wanted to share some online resources, local and national, to learn more about traumatic brain injury. I always like to tell folks, you don't want to Google the term traumatic brain injury to get your knowledge. You never know what you're going to get. Somebody's opinion that may or may not be correct, or something that's really good research-based information. But all of these sites have really good information, resources, and I highly recommend that you check them out. We'll go to the next slide and talk about a couple apps that are out there. So the VA and the DoD have put out a whole series of great apps. They're free. One of them is the Concussion Coach, and this provides education about TBI and symptom management strategies. So you can check that out. We'll go to the next slide just to share some of the other great free apps. So the Insomnia Coach, and this is really related to that CBTI program. I mentioned the PTSD Coach, Breathe to Relax, Time to Track, Mood Tracker. All of these are great. We'll go to the next slide, please. And then finally, I wanted to share with y'all a great podcast series that I actually just recently discovered. And this is put out by the National Academy of Neuropsychology Foundation. And they have individual mini podcasts on sleep, exercise, and nutrition, and how they impact brain health. So highly recommend those as well if you want to learn more about these areas.